What do you think of when you think of pharmacy? For many of us, we think of our local CVS or a quick stop and shop to fill up on our prescriptions. But for people with chronic and serious illnesses, a pharmacy is so much more than just that. For these people, a pharmacy is an intricate and essential part of their care team. However, it's not always seen that way. Today, we will be sitting down and talking to Gilbert Russell, Director of Business Development and Patient Care here at our pharmacy, to learn more about the importance of picking the right pharmacy, as well as what to expect from them.
My name is Gilbert Russell. I'm the Director of Patient Care and Business Development with ASAP Pharmacy. ASAP Pharmacy is a specialty advocate pharmacy. We focus in on those chronic illnesses in which people require an extra level of care beyond what they would get at their normal neighborhood pharmacy. Historically, ASAP initially worked with patients who had hemophilia, since that's within the foundation of the company. But after that, they began to work with patients that had other types of expensive chronic illnesses, for instance, rheumatoid arthritis or Crohn's disease or MS. We've recently gotten into the Lyme disease space. And so it's not that specialty pharmacy can cross a lot of different barriers and genres, but they're not going to be those diseases that you would normally get filled at your neighborhood pharmacy. You know, one thing that stands out with specialty pharmacy over just your regular pharmacy is you begin to see how your health requires a team approach. And so you need other members besides just your doctor to play a role in your healthcare. And a pharmacist and a pharmacy are one of the more crucial members of your healthcare team that you need. For instance, you kind of take for granted that when you go to a neighborhood pharmacy that there are no questions. Well, in specialty pharmacy, there are always questions because you have side effects. You also have questions about how your body is responding or how your loved one's body is responding to those meds. A pharmacist, as a part of your healthcare team, is able to get questions answered after you leave the doctor's office much better than you can. And that's where they've been the most successful member of your healthcare team. Another critical member within specialty pharmacy that's an integral part of your healthcare team is your patient care advocate. And that's the person that wears a number of hats beyond prescription to help your life out. For instance, they can do your local delivery. So not only do they get the prescription filled, they might be the ones that comes to your door. And there's a specific reason why. One is because you want to know that someone cares, that it's someone beyond just UPS or FedEx, but that there is a real live person from the pharmacy that's a part of your healthcare team that wants to see visually that you're doing as well as you say. They also want to see if there are needs that you have that are beyond the prescription. Sometimes you have a financial crisis that needs to be addressed. Your patient care advocate can work in those areas to try to provide you the support that you need. Sometimes you're having problems with your insurance. And when you do, you need someone that can stand alongside of you. You have to be the chief spokesman. But once that's done, then your patient care advocate can also spring into action and provide you the level of support and answer some of those tough questions that the insurance company may try to throw at you. You also find that when you have an expensive chronic illness is that there's oftentimes not enough money in the month. And so you need some financial support, and your patient care advocate's responsibility is to try to find those resources that can come alongside you and provide that level of support. Sometimes it's just day-to-day things. Other times it's how do I pay for my tuition? How do I pay for this car repair that I didn't anticipate? How do I get some of those things that are integral to my life and my quality of life? How do I get those addressed when I have no other place to go? Your patient care advocate's responsibility, and actually their privilege, and maybe even their joy, is to be able to step into those spaces and alleviate any stress or concern that you have. Because if there's one thing we know that's integral helping anybody that's struggling with any kind of illness is to try to alleviate as much stress as possible. You know, as you contemplate this new time in your life, where you're dealing with something that you didn't really plan for, you didn't anticipate was even going to occur, there are steps that you can take to really ensure that you get the level of care, that you get the number of questions asked that need to. Understand that in the times that we're living now, one of the biggest things that happens when you're diagnosed with a chronic illness is that people want to choose for you. They want to choose the doctor that you go to. They want to choose the pharmacy that you go to. They want to really kind of direct your life according to what they believe is in your best interest. If I could encourage you in one way, I would encourage you to take the time and ask the questions that are necessary and make sure that you're getting the level of care that you feel is going to fit the situation that you find yourselves and your family members in. Choice is a big thing in specialty pharmacy. Because of the expensiveness of the drugs in which you're taking, you've got insurance companies that try to steer you to where they want you to go. And oftentimes that results in a lower level of care than you actually deserve. So understand that you have the right to kind of choose where you get your service from. And as an advocate, you have to advocate first for yourself, but then you can get others that will come alongside and advocate for you. So please understand that you have choice. Take advantage of that. Choose the best doctor that you can get. At the end of the day, the insurance company kind of dictates how much they will get paid. We can't get paid anymore. And it's the same way with your specialty pharmacy. Make sure that specialty pharmacy is not out just to fill a prescription, but that they want to help you experience a fuller quality of life beyond the prescription.